Many people would have said that I was going to be a statistic, that I was going to follow in those footsteps, but people in the community, adults in the community, organizations saw me and they saw something special, and instead of throwing me away like society wanted to, they invested in me. And now throughout my career, I've been able to support thousands of young people and position other people to support thousands of young people.
Hi, my name is Paloma Soto. I am 23 years old. Been around CCFC since I was 14, 15 years old. I am actually a former youth participant. I'm currently now on staff. Currently the Healthy Hood Initiative Program Manager, which is our food program. I was raised in Globeville, Denver. Growing up in Globeville as a first-generation child of immigrant parents and Spanish being the language spoken at home, life was hard, food insecurity, low income, my father struggling with addiction, and living in a community where mental health resources weren't accessible. CCFC changed that for me.
We are working to destigmatize the idea of mental health and accessing resources to support and cultivate good mental health.
What is the topic? Well, no. Mental health in prisons, and then why did I pick this topic? I chose this topic because there's a lot of issues going on in prison. It doesn't matter where they come out of, just because they don't get the help and support that they need while they're in prison. So it just doesn't benefit them at all in any way. And then according to the Bureau of Justice stats, around 37% of people in state and federal prisons were diagnosed with mental illness compared to the 18% in the general U.S. population.
More than 60% of kids under the age of 18, 1 out of 6, experience a mental health disorder such as depression, anxiety, or substance abuse. Yet nearly half do not receive treatment, which meant most kids struggle a lot, like let's say in schools, at home, and they don't get treatment for that, which causes to build a lot of mental health problems.
I became part of the youth program in Waliti and Girasol around sophomore year of my high school. I was diagnosed when I was in 7th and 8th grade of middle school. Depression, anxiety. For a lot of people and a lot of kids don't really understand how to gain support systems. Joining this, I was for sure shy and very anxious. And
hi, I'm Jimena. I'm here to talk about the Tia Talk.
as time goes by, I truly had a change of myself within going to therapy, eating better, and just being able to live life to my fullest and just regain that happy side of me that I've lost. CCFC has truly impacted my life, my family, my support system. I'm really grateful. And I just want to say thank you. It's really going well and I'm really happy about it. So I'm just proud of myself. Yeah.
My experience regarding mental health and the system of incarceration and even how we deal with substance abuse and misuse is really rooted in my experience with my mom. My mom had a drug addiction and she was self-medicating. Instead of being given services to deal with her addiction, she was criminalized. She was incarcerated. When my mom was released from her incarceration, because my mom's children were taken away from her, social services was involved in the transition of her coming back into community and obviously getting her children back. I have really, really vivid memories of the social worker. There was a huge lack of dignity. It reinforced this separation between my mom and her children when they should have been encouraging that kinship. They should have been encouraging the reconnection of our family. And for us as her children, watching this interaction made us look at our mom a certain way. Really caused a lot of harm. I utilized that experience as a tool to do things better moving forward. Working to give the youth and the families that we serve a sense of dignity, respect, confidence, treat them as a part of our extended family. We really focus on culture as a strength. We create an organizational culture that increases the likeliness of specific populations and community members accessing mental health support. It really makes me proud to be part of an organization that is unapologetically centering the lived experience, the culture, and the agency of the youth and families that we serve.